So you've had a liposuction surgery done. Now you're recovering from the surgery. You need to know whether what you're going through is something that's normal or if it's not, if you need to see your doctor again. Hi, I'm Dr. Saumil Shah. I am a plastic surgeon, director of plastic surgery at Skinzone Aesthetics in Borivali, West Mumbai. And in this video, we'll be talking about in liposuction recovery, what's normal and what's not. Post-liposuction surgery, there are three things that all patients have, no matter how it's done, whether it's a simple liposuction in the traditional way, whether some devices or technology such as power-assisted or ultrasound or laser or vaser, whatever you call it has been done. In all of these surgeries, you're going to have some swelling, you're going to have some bruising, and you're going to feel numb all over. These are three things that are normal part of your recovery process. For this, the surgeon would have told you to take a few precautions. You would have been told to wear pressure garments to decrease the swelling and also decrease the chances of other complications. You would have been taught and told by your surgeons to do regular massages, what are called as manual lymphatic drainage massages. These are unlike your spa massages. These are things that are needed to drain your swelling. A little bit of bruising under your skin, which is basically a little bit of blood collection under your skin, is normal. However, if you have a lot, it's something again which is not. Numbness. Numbness is something that no matter where in your body surgery is done, you will experience it. It's basically a little bit of detachment of the sensory nerves, which are basically small twigs going into your skin that get disrupted. But don't worry, these usually grow back and you start feeling normal after about 3 weeks to sometimes up to 3 months. During this period of getting your sensation back, sometimes you may also feel tingling, you may feel itching. Some people also feel like that area is on fire. However, all of this is normal part of your recovery. Post-liposuction, sometimes say after a month or so, if you have some areas which have not been massaged well and you still have some swelling, you will see that that area feels a little lumpy. However, this too is a routine part of your recovery and you will have to just massage it off. So apart from these routine things, and maybe a few things that your surgeon might tell you specifically depending on the type of liposuction you get, there are things that you need to look out for which are not a routine part of your recovery. One, if you have sudden swelling somewhere that has become very large and you feel like it's moving around in your body, it might be what is called as a seroma. Seroma is nothing but fluid collecting in your body which cannot be resorbed by your body. So if this is there, it's not normal. Again, not very dangerous. We just need to sort of put in a small needle and take this fluid out. If you have a lot of bruising, especially in your flanks, you need to meet your surgeon immediately because it might be a sign of a little bit of internal bleeding. If it is not too much, your surgeon will ask you to just wear your pressure garments and just not think about it, for it will recover. If it is increasing, and if you are someone who's probably on blood thinners and have not stopped them or have failed to mention them prior to your surgery, then this can be very dangerous. So in these cases, do meet your surgeon. Third, if you have irregularities staying after say 1.5 months, and if they have become very hard, again, it's something that needs to be dealt with as soon as possible to decrease the amount of irregularities that you would later have on your skin. These need to be dealt with massages and if needed even injections. Now coming to the recovery processes where you need to be very vigilant about and you need to inform your doctor immediately. If you have fever, if you have redness, if you have pus coming from any of the liposuction sites, all of these things need to be informed to your doctor immediately. If you're someone who has a very low threshold for pain, you may feel a little bit of pain. However, if the pain becomes very high and if it keeps on increasing in spite of you taking a lot of painkillers, inform your doctor. If you do not pass flatus or pass stools for 5 to 7 days, again inform your doctor. Normally, people do have constipation for a day or two, or maybe even 3 days after the surgery, but they do pass flatus. So if you're not passing even flatus or gas, do inform your surgeons, because this is something again they need to know. One last thing, which usually is a very rare occurrence with liposuction but can still happen, is basically skin blackening or the skin dying. If this does happen, the surgeon will tell you what to do and how it can be managed. However, again, it's something that is a complication and not a routine part of surgery. This is what was normal and what was not after your liposuction surgery. So if you want to know more about it, do get in touch with us, or you can put your comments in the comment section below and we will be happy to answer. Or you can drop in to our clinics at Borivali West in Mumbai.